Hello everyone and welcome back to my channel. I'm Dr. Sarah Mitchell, a board-certified urologist with over 15 years of experience helping patients understand their bodies and improve their intimate health. Today we're diving into a topic that many people are curious about but few medical professionals discuss openly: the proper anatomical approach to manual stimulation for women. And before we begin, I want you to hit that subscribe button right now. Ring the notification bell and drop a comment below telling me what intimate health topics you'd like me to cover next. Your engagement helps this channel reach more people who need this medically accurate information. Now, I know this might seem like an unusual topic for a urologist, but here's the thing. Understanding anatomy, nerve pathways, and physiological responses is exactly what we do. And when it comes to intimate health, proper technique isn't just about pleasure. It's about safety, respect, and understanding the incredible complexity of the human body. So if you're ready to learn the 5 scientifically backed techniques that respect female anatomy and can transform intimate experiences, stay with me. And don't forget to check the first comment and description for information about prostate health supplements that I recommend for men's wellness. Before we dive into techniques, we absolutely must understand the anatomy we're working with. This isn't just about being effective, it's about being safe and respectful. The external female genitalia, or vulva, contains over 8,000 nerve endings. That's twice as many as the male anatomy. We're dealing with the clitoris, which extends much deeper than most people realize, the vaginal opening, the urethral opening, and various sensitive zones that respond differently to different types of stimulation. Here's what most people don't understand from a medical perspective. The clitoris isn't just that small external part you can see. It's actually a complex structure that extends internally, forming what we call the clitoral complex. This includes the glands, the body, the crura, and the bulbs, all of which can be stimulated through proper technique. The vaginal canal itself has different zones of sensitivity. The first third, what we call the introitus, contains most of the nerve endings. The famous G-spot is actually the urethrovaginal sponge, which surrounds the urethra and can be felt through the anterior vaginal wall. Now here's the crucial medical point. Every woman's anatomy is slightly different. What works for one person may not work for another, and that's completely normal. The key is communication, patience, and understanding these anatomical principles as a foundation. Let's start with technique number 1, the gentle approach. From a medical standpoint, this is absolutely crucial because we're dealing with highly sensitive tissue that can be easily irritated or damaged. The first rule of proper technique is lubrication. The vaginal tissues are mucous membranes, similar to the inside of your mouth. Without adequate lubrication, friction can cause microtears, irritation, and discomfort. Natural lubrication is ideal, but don't hesitate to use a high-quality, body-safe lubricant. Start with what I call the feather touch approach, using just the pad of your finger, never the nail. Begin with the lightest possible contact around the external areas. Think of it like taking someone's pulse. You need just enough pressure to make contact, but not so much that you're applying force. Begin at the mons pubis. That's the soft, fleshy area above the clitoris, and work your way down slowly. Spend time on the outer labia, the inner labia, and gradually work toward more sensitive areas. This isn't rushing toward a destination. This is about building arousal and allowing the body to respond naturally. From a physiological standpoint, this gentle approach allows blood flow to increase to the area, which enhances sensitivity and natural lubrication. It also gives your partner time to relax and become mentally engaged, which is absolutely crucial for a positive experience. Remember, if there's any sign of discomfort, dryness, or resistance, slow down or stop. The body will tell you what it needs if you're paying attention. Now let's move to technique number 2, the 2-zone method. This is based on understanding the different types of nerve endings and how they respond to stimulation. The clitoral glands, that's the visible part of the clitoris, contains primarily what we call fast-twitch nerve fibers. These respond to lighter, more rapid stimulation. The vaginal opening and the first third of the vaginal canal contain more slow-twitch fibers that respond better to sustained pressure and slower movements. Here's the technique. Use one finger to provide gentle, consistent circular motions around the clitoral area, not directly on it initially, but around it. Think of drawing small circles on a clock face, varying between clockwise and counterclockwise movements. Simultaneously, use another finger to provide gentle pressure at the vaginal opening. Don't insert immediately. Just provide gentle, rhythmic pressure that allows the body to naturally open and invite deeper contact. The key here is coordination and patience. You're essentially providing two different types of stimulation that complement each other. The external stimulation builds arousal, while the gentle pressure at the vaginal opening prepares the body for deeper contact. From a medical perspective, this technique respects the different nerve pathways and allows for a more complete physiological response. You're not just focusing on one area, you're engaging the entire complex of sensitive tissues. And remember, communication is key. Ask for feedback. What feels good, what doesn't. Every person's preferences are different, and what works one day might not work the next. That's completely normal. Technique number 3 is all about rhythm variation, and this is where understanding physiology becomes really important. The human nervous system responds to patterns, but it also adapts to them. If you maintain the exact same stimulation for too long, the nerve endings can become less responsive. We call this sensory adaptation. The solution is strategic variation. Start with slow, deliberate movements. Think of a heartbeat rhythm, steady and consistent. Spend about 30 to 60 seconds establishing this baseline rhythm. This allows the body to relax into the sensation and begin building arousal. Then, gradually increase the speed and intensity. Not dramatically. Think of it like slowly turning up the volume on music. You want to build intensity without shocking the system. Here's the crucial part. Periodically return to that slower, gentler rhythm. This creates what we call arousal waves, building up intensity, then allowing it to settle slightly before building again. This prevents overstimulation and can lead to more intense and satisfying experiences. From a neurological standpoint, this variation keeps the nerve pathways engaged and prevents that adaptation I mentioned. It also builds anticipation, which is a huge psychological component of arousal. Pay attention to your partner's breathing, muscle tension, and verbal feedback. The body will tell you when to speed up, slow down, or maintain the current rhythm. Don't follow a rigid pattern. Be responsive to what's happening in the moment. And if you're watching this video and finding it helpful, please hit that like button and share it with someone who might benefit from this medical perspective on intimate health. Technique number 4 focuses on pressure points, and this is where my medical training really comes into play. There are specific areas of the female anatomy that contain concentrated nerve endings and respond particularly well to targeted pressure. The most well-known is the anterior vaginal wall area, where the urethrovaginal sponge is located, commonly called the G-spot. To locate this area, insert 1 or 2 fingers about 1-2 inches into the vaginal canal and curve them upward toward the belly button. You're looking for an area that feels slightly different in texture, often described as feeling like the roof of your mouth or having a slightly ridged texture. Apply gentle, consistent pressure using a come here motion with your fingers. The pressure should be firm but not aggressive. Think of the pressure you'd use to press a doorbell, not to push a heavy door. But here's what many people don't know. There are other pressure points that can be equally effective. The posterior fornix, the area at the very back of the vaginal canal, contains nerve endings that respond to gentle pressure. The area just inside the vaginal opening, what we call the introitus, is incredibly sensitive to light pressure and gentle stretching sensations. The key with pressure point stimulation is consistency and patience. Don't expect immediate results. These areas often require sustained, gentle pressure for several minutes before they become highly responsive. And please, never apply sudden or aggressive pressure. These are delicate tissues with complex nerve networks. Gentle, sustained pressure is always more effective and safer than aggressive manipulation. Remember, not every woman will respond to G-spot stimulation, and that's completely normal. Anatomy varies, and what's most important is finding what works for your specific partner through communication and exploration. Now we're ready for technique number 5, the advanced combination. This is where we bring together everything we've learned about anatomy, rhythm, pressure, and coordination. This technique involves simultaneous stimulation of multiple areas using different types of touch. You'll use your thumb for gentle circular motions around the clitoral area, your index finger for internal pressure point stimulation, and your middle finger for rhythmic pressure at the vaginal opening. Start with all 3 contact points using very light pressure. Establish a slow, coordinated rhythm where all 3 movements complement each other. Think of it like playing a complex piece of music. Each finger has its own part, but they work together to create harmony. The thumb maintains those gentle circles around the clitoris, varying between direct and indirect contact based on sensitivity. The index finger provides that sustained pressure on the anterior wall, using the come here motion we discussed. The middle finger creates gentle rhythmic pressure that can gradually increase in intensity. Here's the advanced part. You're going to vary the rhythm and intensity of each finger independently. While your thumb might be maintaining a steady rhythm, your index finger might be applying sustained pressure, and your middle finger might be varying its rhythm. This requires practice and concentration, but the physiological effect can be incredible. You're engaging multiple nerve pathways simultaneously while providing the variation and complexity that prevents sensory adaptation. This is definitely an advanced technique, and it's not necessary for everyone. Some people prefer simpler, more focused stimulation. The key is reading your partner's responses and adjusting accordingly. And remember, if you're finding this information valuable, please subscribe to my channel and hit that notification bell. I regularly share medical insights about intimate health that you won't find anywhere else. Now let's talk about the common mistakes I see that can not only reduce effectiveness, but can actually cause harm. Mistake number 1, going too fast, too soon. The female anatomy requires time to become fully aroused. Rushing to intense stimulation before the body is ready can cause discomfort and can actually inhibit the natural arousal response. Mistake number 2, using too much pressure. Remember, we're dealing with some of the most sensitive tissues in the human body. More pressure does not equal more pleasure. In fact, excessive pressure can cause pain and can damage delicate tissues. Mistake number 3, ignoring lubrication. Dry stimulation can cause microtears in the vaginal tissues, leading to irritation, pain, and increased risk of infection. Always ensure adequate lubrication, whether natural or artificial. Mistake number 4, following a rigid routine. Every person is different, and even the same person can have different preferences on different days based on hormonal cycles, stress levels, and other factors. Flexibility and communication are essential. Mistake number 5, neglecting hygiene. Always ensure your hands are clean, your nails are trimmed and smooth, and you're in a clean environment. The vaginal area has a delicate bacterial balance that can be disrupted by poor hygiene. And perhaps the biggest mistake, not communicating. This isn't a performance where you're supposed to figure everything out on your own. Ask questions, pay attention to responses, and be willing to adjust your approach based on feedback. As a medical professional, I need to address some important health and safety considerations. First, be aware of signs that indicate you should stop immediately. Any bleeding, unusual pain, signs of irritation, or if your partner asks you to stop for any reason. The vaginal tissues are delicate, and it's always better to err on the side of caution. Second, understand that some women may experience what's called female ejaculation or squirting. This is a normal physiological response that involves fluid from the Skene's glands. It's not urine, and it's nothing to be concerned about. Third, be aware of the risk of transferring bacteria. Never go from anal contact to vaginal contact without thoroughly washing your hands. This can introduce harmful bacteria and cause serious infections. Fourth, understand that not every woman will be able to reach orgasm through manual stimulation alone, and that's completely normal. The goal should be pleasure and intimacy, not achieving a specific outcome. If you or your partner experience persistent pain, unusual discharge, bleeding between periods, or any other concerning symptoms, please consult with a healthcare provider. Don't ignore potential health issues. And speaking of health, men watching this video should also prioritize their own intimate health. Prostate health becomes increasingly important as we age, and I've included a link in the description and first comment for a supplement that I recommend for prostate support. So there you have it, 5 medically informed techniques that respect female anatomy and can enhance intimate experiences for both partners. Remember the key principles: start gently, communicate constantly, respect the anatomy, vary your approach, and prioritize safety and comfort above all else. But here's what I want you to understand. Technique is just one part of the equation. Emotional connection, communication, patience, and mutual respect are just as important as any physical technique. If you found this video helpful, I need you to do 3 things right now. First, hit that subscribe button and ring the notification bell so you never miss my medical insights on intimate health. Second, give this video a thumbs up to help it reach more people who need this information. And third, leave a comment below telling me what other intimate health topics you'd like me to cover. Your engagement helps this channel grow and allows me to continue providing medically accurate information about topics that many people are curious about but afraid to ask their doctors. Don't forget to check the link in the first comment and description for information about prostate health supplements. Taking care of your intimate health is important at every age. Thank you for watching, and I'll see you in the next video where we'll continue exploring the fascinating intersection of medicine and intimate health. Until then, stay curious, stay safe, and remember, knowledge is the best foundation for any intimate relationship. This is Dr. Sarah Mitchell, and I'll see you soon.